You cannot take a CBC and it takes 24 hours for you to get a result.
A few days ago, Court of Appeal Judge Justice Irene Mulyagonja publicly castigated Mulago Hospital while referencing on the neglect and lack of basic medicines she endured as she nursed her husband, the now late J.B. Kakoza.
And then the tests, if you want blood work, they will tell you, we can do this one and we can do this one. The rest of them, please go outside and do them there. But it's called the National Specialized Hospital.
Renowned for taking no prisoners, Mulyagonja said many uncharitable things about Mulago National Referral Hospital, including likening it to a mere monument.
So I want to say that yes, we have that hospital there, but I think it's just a monument.
Mulyagonja's utterances have since sparked off a very polarizing public debate to which Dr. Joel Mirembe, the General Secretary of Uganda Medical Association, contributed in the following Monday interview with Mulengera. Take a listen.
Dr. Joel Mirembe, you can briefly educate us and our viewers about the following. CBC, what is it in full and what purpose does it serve in medical processes?
CBC, it simply means complete blood count. And it's a test, it's a basic test that we do to assess a few parameters. One, white blood cells, red blood cells, and someone's platelets. So we use it to assess the hemoglobin levels, that is how much blood someone has. Then we look at the white blood cell to see whether they have any kind of infection. It can be viral, it can be bacterial, among others. Also, it supports us to assess for blood cancers, like leukemia, among others. It also supports us to see whether your blood can effectively clot to protect you. For example, some people, when they get a cut, they bleed almost endlessly. So platelets help to form a clot where you have been cut to ensure that you don't bleed out. So that is in layman's language, that's a complete blood count test, and it's a basic test that every patient who has an alignment they are complaining of should usually receive.
Okay. Then you also educate us about insulin.
Yeah, insulin is a hormone in the body that is responsible to cause glucose to leave blood and enter cells. Cells are the smallest functional unit of the body. So when glucose doesn't leave blood and continues to circulate, the cells will starve. So insulin is that kind of dealer, blocker, that aids glucose entering the cells such that the cells activities of these cells can continue. So now is a disease called diabetes.
Okay.
And diabetes type 1, type 2, everything around diabetes relates around insulin hormone. The hormone is produced by an organ of the body called the pancreas. So in diabetes, there are types, of course, that maybe you don't need to go through the type 1, type 2, but it's around insulin failing to do its job of causing glucose to enter the cells, such that then glucose accumulates, and then you get these other symptoms of either you can become too fat or too small, depending on the type of diabetes you have. So it is also the insulin, that hormone. Now technology has advanced, is being manufactured artificially, and when you have diabetes, it can be administered through a needle, such that you can have it, the body to do the work of transferring glucose from blood into cells. So it is given to you at intervals.
As an injection.
As an injection. You can be getting twice a day, but before you are stabilized, you can get multiple of them even after maybe 30 minutes. But when you're stable, every patient has their own doses that are customized. So insulin is also another basic drug that every facility must have, because it is an emergency drug as well. It is given to chronic care patients who have diabetes, but also it's an emergency drug in one way or the other.
Then, doctor, thank you on that one. The NG tubes, what does that mean and what do they do?
NG tube, NG means nasogastric. Nose, gastric is the stomach. So that means that is a tube that connects the mouth to the stomach. But it is nasal because it is passed via the nose. Then it moves to the esophagus up to the stomach. Stomach, I'm not meaning the abdomen. I mean that sac-like structure where when you swallow food, where it drops. Okay? Where it drops for further breakdown and the processing, digestion to take place. So, nasogastric tube. So when someone, for any reason, they are not able to eat orally, or when we think them eating via their own mouth can compromise their health, we usually, that's one of the modalities. There are many other modalities, but that's one of the modalities to deliver food into the stomach such that they can continue actually to feed. So the food is grounded into porridge-like stuff, or it can be liquid form, literally, or semi-liquid, and then put into the tube, and it drops by gravity into the stomach. That's the name tube. It's a very basic equipment, if I can call it. Very cheap, ranging between, I think, 300 shilling to 1,000 shilling.
Not even 10,000.
It is a very basic, simple equipment that we use, especially in babies, but also adults. The moment there is a reason, because there are multiple reasons. Someone can be not able to feed because maybe their throat, their esophagus is blocked, or because they can't swallow, or because we think when they actually put food in the mouth, because their reflexes are not functioning well, it can rather go into the lungs. So to protect the lungs, to protect them, we put the tube and also use it actually to check what is in the abdomen, because we want also to know whether the food we have given is being broken down, because if you give food and it remains there, it is also another problem. So there are many uses of an NG tube in the healthcare setting, including supporting feeding of very critically ill patients.
Are you a woman with a small-scale business with a dream of growing it to another level? The GROW Project is here to support you in realizing your dream.
The GROW Project is a government initiative implemented by the Ministry of Gender, Labour and Social Development and Private Sector Foundation Uganda with support from the World Bank.
We support women-owned businesses across the country to gain hands-on and business management skills through training within your location, business financing through grants and affordable loans, and infrastructure in your areas of operation to enable you to increase your productivity.
If you have a business that makes sales of up to 800,000 Uganda shillings per month, the GROW Project has the tools and resources to help you succeed. For more information, contact your district or city GROW focal person or call our toll-free line on 0800 307 777 to learn more about how you can benefit from the GROW Project's services.
The GROW Project, empowering women economically, transforming communities.
Then, Doctor, our next question. When one talks about Ward B of Mulago Hospital, what comes to mind? What exactly are we talking about in terms of quality of service that has to be expected?
Maybe Ward B is not the right term to use. Maybe you would use private wing.
That's what it means.
Of Mulago. In fact, private wing of Mulago Specialized National Referral Hospital. So this is a wing where abakolamu seek care. Yes, where those who have money seek care and they pay for the service. And usually the costs are either equal to private or sometimes even less, sometimes higher. So the prices definitely are determined by government. So the same staff who work in the public side work in the private wing. And the the public wing of Mulago National Referral is already extremely understaffed.
Even the private?
I have said the same staff, they share staff.
Ah, I see.
So already the other side is extremely understaffed. At 40 staffing gap is at 60%. And that means where you need 10 doctors, you have only 4. Where you need 10 nurses, you have only 4. So these are the people who run the ICU, who run the clinics, who run the wards, who do the everything. So now, that is the starting of the problem. So people come to the private wing expecting state-of-the-art, sophisticated pampering.
Yes.
Okay?
That's what it should be.
Yes, maybe that's what it should be. But the pampering, definitely, I want to believe, and it is true, the administration of Mulago would love the pampering to happen.
Yes.
That's why they submitted a budget of about 100 billion to Parliament to fund the entire hospital, including the private wing. But they were given 17 billion. So, if services are supposed to be given at 100 billion plus, how do you say they are going to be given at 17 and they are going to be of quality?
Which is not even a quarter.
Not even a quarter of the budget of Mulago is being given. So that's a big problem. But me, I'm happy that one of the big spoke out.
Yes.
And the private wing, I think actually, in my personal assessment, government should have these hospitals, the so-called privates, stand alone, such that the Bantua ones also we can be alone. Why? Because at the end of the day, you cannot share staff. Yet, you see, there is exploitation of the staff, by the way. Why? You are paid to work in the government, in the public sector, and you have duties there. Then, after that, you have to come and see the private. So these private patients, and from experience, by the way, I treat my patients in Mulago, in Kawempe, in Chirutu, my relatives, my children. I've delivered my children from Kawempe. And I can tell you, you better stay in the public wing. Because there, the doctors are there. And there is that leeway. If something is not available, they are going to write for HT. You can't buy it from the pharmacies outside. You bring it and they work on your patient. Which doesn't happen in the private. Private, they are not going to write for you. They are going to wait until when procurement is done. Those are now the issues I think the council went through, or the judge?
The judge, Justice Mulyagonja. Okay, now, she said many things as her husband was being prayed for at the cathedral. Do you believe, from what you know, that it's possible that, for instance, a CBC can take 24 hours? Would that be normal?
Definitely. Current technology, we receive CBC results in 15 minutes.
Okay.
24
current
hours?
Technology.
But 24 hours can happen even more than that. When the machine is there but doesn't have reagents. And absence of reagents in the machines of Mulago National Referral Hospital is not a news.
It's a common thing. It happens.
It's a common thing. So probably that's one of the reasons. That's the reason why these results kept delaying, because the reagents were not available. And you know, you cannot. It's a government entity. You're going to follow procurement, procurement procedures, bureaucracy, and among other things. And I can tell you, They can bring the monthly reagents, but I can tell you they can't serve even half a month sometimes. Yes. So the reason for CBC delaying is most likely not because the staff didn't take off the blood, they did. Not because they didn't deliver the sample to the lab, they did. Not because there were no lab people to at least work on that sample, they were there. But most likely there were no reagents.
Okay.
Yes.
Then them not having any G tubes, not having insulin, wouldn't that be very strange as well?
It is unbelievable because it's the National Referral Hospital. That's the name. The question we should be having as citizens who seek care from there, is it operating at like one? Is it facilitated to operate like one? Is it supervised to operate like one? Is it monitored to be like one? Does it have the staff? Does it have the equipment? Does it know the real needs of the clients, the category of the clients supposed to serve? Because this is supposed to be the center of excellence for healthcare in the entire country. It's the biggest hospital that we have in the country. It has the most highly qualified doctors, nurses, and all other kind of health workers. Yes, they are not enough. But the few available, are they facilitated, equipped to operate at their optimum capacity? Those are the questions that Justice Mulyagonja and others should be raising fearlessly to government. Because at least if a Justice Mulyagonja went through that experience, think about my peasant mother. And in this case, I'm not referring to my own mother, because at least for her, she has a Mirembe jail somewhere. But I'm talking about that woman or man from Karamoja who knows no one, whose stories will not be heard, will not get the audience for Mulengera to profile. And I can tell you, those are the majority. The categories of Justice Mulyagonja who come to Mulago are very few. And usually they come there for emergencies, and there after evacuation to Kenya, US, Germany, India, among others. So there is a Honorable Betty Kamya. One time said that for them they are not affected by corruption. I think she should revise that statement. Because there is one of her category who is a former, I think, IGG.
Yeah, her predecessor.
Her predecessor, who probably has even retirement benefits. Was here caught between a hard place and a rock. She had to cross and go to Mulago. Her experience was a bitter one, full of frustration, pain, among other things. So they have to come and know that health care is a need that you cannot just extend. If you want to be given insulin, you can't wait for you to go to Kenya to be given. You will die along with the plane, because insulin is a life-saving drug. There is no option. It is life-saving. You either get it or things worsen. But it is very sad if it is accurate, like it is, that there was no insulin in the National Referral. But I can tell you, stockouts in Uganda bagamba baana baliwo. You get it? Stockouts are an everyday thing in government hospitals, including Mulago. And we have asked government severally to fund and prioritize health care. We have made statistics, projections, and delivered them to government, parliament, president, and showed them the value of investing in health care and the returns. Because maybe they are saying, okay, if you invest money there, how are we gaining? And it's very clear, it's global, that when you invest in health care, you get back 10 times in terms of returns. 10 times. So if a country invests in a population to keep it healthy, they are going to be productive, the economy will thrive. And at the end of the day, they will be able to pay fees for their children. They will live a good life. And I think that's what we want as a country.
Okay.
So, as long as the healthcare budget is kept at 3% of the national budget, like the one we are running,
Currently.
you check 72 billion, they give healthcare around 3 trillion, over 72, what do you get? Earlier, it was around 6, but it keeps going down. As we see, parliament budget is, parliament budget is increasing, state house budget is increasing, security budget is increasing, donation budget is increasing. The budget for taking government health workers, sorry, government workers, not government health workers. Health workers in this country have no privilege to be taken abroad to be treated.
They don't even have medical insurance.
They don't have even medical insurance for starters. But the cost of taking MPs, ministers, those who are men of the president, men of the big people in the land, is increasing every year. You check the statistics. You are researchers. You check how the statistics have been increasing for medical tourism by government abroad, India, German, US,
Israel,
and Kenya, Israel among others, Turkey. Why don't they bring that man and invest it in Mulago, and they come and seek care from Mulago? Why do they prefer to get quality care abroad? Can't they improve the system here such that they can get the care here? We have had presidents who sought health care from Mulago. It's not news.
in Uganda.
History is clear that Obote, the Amins, did seek health care from Mulago. Why is it that government officials use taxpayers' money to go abroad in Turkey and other places, get care, when Mulago misses insulin, when Mulago is facing gross, extreme staffing gaps, when it's facing gross funding gaps, when it is facing drug, which is resulting into stockouts, which is resulting into machines not being serviced in time, they break down, and when they break down, you have to rather replace them. Yet if they were serviced in time, they would do the job. So those are the questions we have for government, and I want to implore my seniors, in fact my senior, Dr. Rosemary Byanyima, for the record, since she came as director, there has been a great improvement in Mulago service delivery.
Yes.
But the problem is that, you know, when you have a child and you expect them to be walking at 2 years, then they walk at 10 years. Okay, they start, they give a whisker, hope of walking at 10 years. You celebrate that small what? Hope. But it doesn't mean they are walking. That's where our national referral is. So, I think there is a very big opportunity for the director of Mulago National Referral Hospital, but not actually the doctor, the board, to make a case for funding Mulago. At least we have evidence from one of the big people in the government. And there are very many other people who are silent because they are not brave like the Justice Mulyagonja to speak out. There are very many. And when if you do a survey among the common people who go in Mulago, it will even break your platforms where you post news.
You think Mulyagonja was speaking for so many others?
Yes, that's the truth.
Yes. Now, Doctor, this Mulago Hospital we are talking about, what will it take for it to begin operating like the National Referral Hospital it's supposed to be?
I think it's something small, though for the people who are in government, it seems for them it's very big. But one those who are in decision-making offices, the politicians, to develop a practical political will to prioritize health care. Mulago is the face of healthcare in the country. If Mulago has such reports, what's happening at the regional referral hospitals? What's happening at health center too? So, the first things first, fund health care budget. Increase, at least give Mulago 80% of the budget it needs. That's the first thing. Two, we need the National Health Insurance Scheme to come. Hospitals like HCZ are implementing community insurance scheme. They are private. In Kanungu. And the community is benefiting. The community is very happy. Why is government that we give our taxes failing to implement one? Two or three, Mulago needs to be staffed or put in mammal from the 40% staffing to at least 90% over 100. Three or four, Mulago needs to further get a strong supervision system to avert corruption tendencies. Because one of the reasons, if the Auditor General's report, you will see that there is corruption among healthcare facilities. Corruption that is more administrative. You know very well, the former ED of Mulago is battling corruption charges. And they didn't commit the corruption that he stole maybe cow somewhere. That he stole Mulago National Referral money. Money that is meant to treat common people. When you steal funds that are meant to support the healthcare system, you're a murderer. You deserve to be charged for murder. Because I can tell you there are very many people who are dying in Mulago because of the broken system in Mulago. There are very many people who are dying because probably health workers are also so tired that they are frustrated. They are not acting into their full capacity to support the patients. All those things are happening. That's the reality. And we need to not to miss our words when speaking about them. Because the people are dying are our relatives. They are our friends.